Good afternoon, good evening, good morning, everybody. Thank you very much for joining. I hope that you and your loved ones are safe and healthy and that you are managing despite the very difficult challenges and time in COVID-19 times. I would like to warmly welcome all of you who joined us on today's webinar. My name is Najat Rashdi, and I am delighted to be hosting this peer-to-peer webinar on the duty of care. Just for your information, this webinar was planned before the COVID-19 crisis, and our speaker will address duty of care in general terms and not COVID-19 related. Before introducing our speaker and the topic a little bit further, I would like to say a few words about the webinar and how it works. The webinar will last for 60 minutes. During the first 20 minutes, I will be asking questions to our speaker, and she will be providing us with her reflections on the topic. And I will take also questions from you that I will direct to the speaker. But before we get started, please allow me to provide some technical guidance for those who are not familiar with the webinar and some ground rules that we should abide by through the webinar session. Well, please stay on mute through the course of this webinar because otherwise there will be some interference. And please have your camera turned off so we don't have any issue with the bandwidth. Please use the chat box on the right-hand side of your WebEx window to communicate with everyone on this webinar, but also to send your question. Please feel free to ask all your questions. We will pick up all what we can, and if there are any left, we will still provide you with answers afterwards. And please note that we will be running two polls during the course of this webinar. Your response is very important, and actually that's the way it helps us, first of all, pick up a topic for next webinar, but also for us to improve the organization of those webinars. Last but not least, we will be recording this webinar, and an edited version will be uploaded on the website, and you can find other resources on the peer-to-peer webinar recording as well. Now let me very quickly introduce the topic. I am sure you are all familiar with that because duty of care is at the heart of what we do as humanitarian. But actually, we just realized after discussing with many actors that there are a multitude of definitions attributed to the term duty of care. We all understand that it is related not only to legal obligations, but also to moral and financial obligations of an organization towards its staff. For humanitarians, duty of care refers to the obligation to maintain the safety, security, health, and well-being of its personnel and their family members. It includes the duty on the part of the organization to mitigate or otherwise address foreseeable risks that may harm or injure its staff and their eligible family members. So what we will try to do during this webinar is really to offer the participants with a better understanding of the vital nature of duty of care and, of course, to benefit from the great and large experience of our speaker. It's not that she needs to be introduced. Dr. Jamila Mahmoud is known by everybody, and it's really a great honor and privilege for me to have her on this webinar. She is a humanitarian role model for all of us and for women around the world. She is a seasoned humanitarian who has been the founder of Mercy Malaysia more than 2 decades ago and worked in the United Nations and more recently in the IFRC. She is speaking to us from Kuala Lumpur, which is clearly showing her commitment. And I would like to use this opportunity to congratulate Dr. Mahmoud on her new full-time role as a special advisor to the Prime Minister of Malaysia and also as a member of the Economic Action Council of Malaysia. They are really lucky to have you, Dr. Mahmoud. Thank you for joining us in spite of the time difference and in spite of all your very busy schedule. So without further ado, I would like to start with the first question to you, Dr. Mahmoud. What do you see as a duty of care in the humanitarian sector? Over to you, Jamila.
Thank you very much, Najat. Hello, everyone. I'm so delighted to be able to speak to all of you. And I just want to thank the many people who have registered. I'm quite blown away that 600 people have registered from around the world. And I also want to thank you, Najat, for your very kind words. Duty of care is something we talk about, and we talk about it sometimes quite easily, and yet it is really quite difficult to fulfill, our responsibilities on duty of care. As a humanitarian, I think, we know that you have very clearly articulated duty of care in the humanitarian sector, but I just want to, perhaps for those who may not be too familiar, I believe the CHS Alliance, has one of the best and clearly articulated duty of care guidelines and a lot of tools and resources, and I just want to give them a shout out for their good work. And I think you're absolutely right. It's beyond financial and legal, but the moral obligation to ensure health, safety, and well-being. And it is good practice. It's good practice because it is the fundamental of standing up for the safety of your own staff and protecting those who are out there to save lives. One element of duty of care that sometimes we may overlook is actually the whole element of well-being. And well-being is critical for aid workers, particularly because they need to work in an environment where, they have contentment at work, they feel secure, and they feel that they can maximize their full potential because they're in that secure and healthy environment. And this is something that, we need to think about, not just during the time that people are in our employment or working for an organization, but also after. So duty of care has become so important now because we are seeing increased hostility towards aid workers. And particularly, if I can refer to two slides, if it can be shown, Venkatesh, that we see major security incidents rising between 2009 to 2018. And I just want to thank Abby Stoddard, who has provided me with these slides. And if you haven't yet, I would really highly encourage you to read her latest publication, Necessary Risk. And from this simple, bar diagram, you can see clearly that, the lighter numbers of increasing aid workers insecurity between in that last 10 decades. If I can look on the 1 decade in the next slide. And this is something also from the Aid Worker Security Database, where it looks at fatality rate per 100,000 in 2017. And what is very, very striking is that, humanitarian aid workers are being targeted, and the rate of attacks and fatality is even higher than, U.S. combat forces and law enforcement officers in the U.S. So this tells us that if we don't take aid workers' safety and security and well-being seriously, we will see, with the increasing trends, greater stresses to the humanitarian sector. I'll pause there, Najat.
Thank you very much, Dr. Mahmoud. I mean, yes, the well-being and the mental health of the humanitarian aid workers is really key, and we have seen a lot of thinking going on regarding that, but it did not start today. I mean, much of our focus of late, since the World Humanitarian Summit and the Grand Bargain, which you were also directly involved with, has placed already a lot of emphasis on local actors. So
Yes.
from your point of view and based on your experience, and it will be good also to have some inputs from the participants, do you feel that local actors benefited from duty of care by the international partners? Over to you, Dr. Mahmoud.
Thank you, Najat. I mean, certainly, a lot of what we heard during the consultations of the World Humanitarian Summit was local actors and local governments also speaking up to say that, they were on the, if you like, front lines of humanitarian response, particularly in very insecure and hostile environments, and yet felt the most left out in terms of their security. And if I can show the next slide, and this is something that is very worrying. If you just look at the trend, you'll see that there's a rising trend in the rate of attack of national actors. And 90% of the victims who are affected are national aid workers. And this is also increasingly fatal, and therefore the fatality rate is about 3 times higher. What this also shows, when you look at the details of this report, is that there's a reliance on the partner organizations that are local and national, and an increasing nature of remote operations, particularly by international actors. Now, what this tells us is that, we have shifted the risk to national and local actors without necessarily shifting the capacity to manage risk. And I think this is the principal problem that we need to really tackle. And I think that, if you ask local actors, what would they like, because they are there. No matter whether an international actor is funding them or not, in a crisis situation, it is still the local actors who are going to be on the ground. And what they really want is really, the capacity development and the ability to also manage their security risk. I must say that over the last few years, we are seeing an increasing commitment from the UN and other international organizations to invest in the security, knowledge of security by the national and local partners. If we look at the INGO Security Organization database, you'll see that in 2018, for example, about 20% of those who were trained on security were national and local humanitarian actors. And this is very encouraging, but obviously 20% is not enough. There has to be more than that. But we need to go beyond just training and capacity development, but much more into, financial resources for local and national actors, and so that they are actually able to develop their own security risk framework. They'll be able to invest in tools, whether it's radios or whether it's secure vehicles, for them to be able to carry out their work, in a much more safer environment. I think one of the things we have, certainly with my previous very privileged opportunity to work in the Red Cross and Red Crescent movement, we see that, for us in the Red Cross Red Crescent movement, the national societies, are the ones who are actually going out, but not just in terms of staff, it's also volunteers. And we have seen, for example, in places like Afghanistan, where, these are the volunteers that are going to the ground, running vaccination programs, and so on and so forth. And a lot of the reason why they're able to access is the trust. And it's about communities, knowing who they are, the cultural nuances, understanding those communities. But even in those circumstances where there is trust, if you don't have enough, phones, you don't have even proper lighting in your vehicles, and proper tools that make you visible to the people, you put yourself at risk. And these sometimes are very small, trivial things, but they are very, very important. And maybe I'll touch a little bit on, how do we look at insurance for local and national actors. It's often very difficult to find local and national actors that are well insured. Our experience in the Red Cross and Red Crescent movement is that our national societies have an opportunity to buy a very low-cost insurance. But even then, many local and national actors don't have that ability and that access. perhaps one thing that needs to happen is that there has to be some kind of social contract and a commitment from international actors and donors who are using the services of local and national actors to actually put aside a certain amount of funds that is for their insurance, for their safety, their well-being, and certainly for investing in their own security and risk management.
Thank you very much, Jamila. But you know, there is always one question that is repeating itself in every single situation, especially in conflict-related environment and crisis. And what about the families? What's about the relatives of, you know,
Yep.
the staff directly? What do we do for them? How can we still protect them? And how can we exercise our duty of care? Over to you.
You're absolutely right. I think, you know, coming back to the previous point about mental health, right? I mean, mental health concerns of aid workers is something very real, whether it is in a conflict setting or even in a pandemic situation where you're out there, you know, dealing with so much uncertainty in a pandemic. And the families are the ones who are left behind, often, you know, very, very much unsupported. And I think duty of care does extend to families. And I think this is where our shift in how we take care of ourselves and our own workers before we think of anything further than that is going to be very important. You know, insurance is one way where if there is, you know, a morbidity or mortality, there could be insurance coverage that helps the families cope. But it's beyond financial, you know, beyond financial means that they want to receive this support. It's also, you know, ensuring that there is an opportunity for them to be in touch with, whether it's counselors or whether with the organization itself, you know, paying attention to their needs and, you know, calling in to find out how they're doing and so on and so forth. So I think we are not so, we're still quite far from the ideal. And certainly it's something we need to work harder on.
Thank you very much, Jamila. There are a lot of questions also regarding when you refer to insurance. Do you have a concrete example to share with the participants, please? Thank you.
Yeah, I can give you the example of my previous work experience with IFRC. We offer a very affordable insurance for our national societies to pay a small premium, about, if I'm not mistaken, it's about $1.50 per volunteer, where you can have a you know, insurance for cases where they are injured or where they are killed. But, you know, $1.50 or $2 or even $5 for you and me is probably not significant. But for many small organizations, this is operating costs and capital expenditure, and it's high for them. So I think that, you know, what we need to look at as well, I mean, one of the things, of course, I'm not in IFRC now, so I can't speak on behalf of them, but it will be important for networked organizations to also think about some form of, you know, staff welfare fund that can be, you know, a deductible or, you know, a contribution, or even to speak to donors about, you know, every contribution for any particular grant, there is a proportion that has to be put aside for, you know, staff welfare or insurance, particularly when that organization is an implementing partner to another larger organization. So I think, you know, one thing we also need to do is, as a wider humanitarian community, why aren't we negotiating with large insurance companies to have a universal insurance coverage for humanitarian workers? I think if you go in large numbers, it's easy for you to make a good deal with insurance companies, but not just for the international actors, but for the local ones as well.
Yeah, thank you. But we all know that there are a number of places where, because of the conflict or because of sanctions, actually from some countries, areas insurance won't cover, those countries. And I can give you a very simple example, which is about Syria, but there are also other countries. So what can we do in such situations, Dr. Mahmoud?
Sorry, Najat, I lost you for a second. Can you repeat that?
Yeah, in many areas, insurance won't cover some countries because of sanctions or because of anything else. And Syria is a very good example. So from your point of view, what can we do in such situations? Over.
Yeah, I think this is where I'm saying that how do we negotiate as a wider and larger entity? That's number one. But you and I know in some countries where there are sanctions, it's extremely difficult to get an international insurance company to actually pay a cover to have a coverage of staff. Then what will be required is for organizations themselves, as I said, to set up their own internal funding mechanism. I want to give you an example that is probably completely non-humanitarian, but something to think about as a stimulus for us to rethink how we look at welfare. In Islamic practice, there's something called hayriat, and this is when there is a death, there are funds contributed for taking care of the deceased and their families. And this comes from either the employer or from the community. I think we need to look into some innovative models where you can actually develop some internal funding mechanisms particularly where insurance is not available. Chances are, if you have that kind of mechanism, number one, it provides some comfort and security to your staff that you're taking care of them and able to meet some of their needs. But secondly, it opens up different opportunities for you to raise funding and have that dialogue with your donors on ensuring they also have a responsibility to duty of care. It's not just the principal organization, but also whoever who's funding the organization to deliver assistance. There was a question, I just saw the question. There was a question on whether there's guidance on ministries on insurance with pandemics and so forth. I think I will speak about my own experience now. We are actually asking questions in the government now to say, well, how do we protect our frontline workers, so to speak, right? What kind of mechanisms? And of course, in the government, if you're an aid worker, then you have some form of, I'm sorry, not aid worker, if you're a staff in the government working, say, in a hospital or in an institution, you have your own, regular insurance and hayriat and so on and so forth. But what do we do now with others who are actually going out there delivering assistance from community-based organizations, so to speak? So I think this has really made us question, how do you take care of duty? How do you take duty of care into consideration in very abnormal and unexpected situations?
Yeah, there are several questions, and it's very difficult to pick up one. But there are two things, and I think it will be great to hear from you. We know how insurances, with all due respect, are always, very much negotiating whenever comes the time for them to pay. And based on experience of many of us, humanitarian, it's very difficult to argue about mental health, and there are always some issues there. So we would love to hear from you about that. But related to that, whenever we are providing a contract, whether to a national or an international, the entitlements are very clear. But do we need today, because of the lesson learned, because of many things, do we need today actually to add it formally as an entitlement in the contracts, whether to national or international? Over to you, Dr. Mahmoud.
I completely agree that it should be part and parcel of a contract between a employer and a staff. I think that, you know, every member of staff has a right to know that when he or she joins an organization, that the duty of care to her will be fulfilled. So I think contractually, I think it's critical, and we are now, you know, in the 21st century. We need to be thinking this way. The other thing, of course, is that there was a really good remark in the. I'm talking to you and looking at the comments at the same time. Someone said, "How about OCHA pooled funds for national humanitarian staff?" Absolutely, I think that, you know, if OCHA pooled funds are there, you know, and it has done, you know, quite good work in ensuring that national staff and national organizations get access to funds. But I think that, you know, where that is used, you should actually think about how a certain amount is set aside. Again, it's not up to the person managing the fund, but it's negotiation with the donor as well. I think this is really important. Um, are you hearing me, Najat?
Yes, I mean, thank you very much, Jamila. I don't know if you have seen the other question, which is also very
Yeah.
interesting, on the preventive and
Yes.
preemptive side of duty of care.
Yes.
How can organization be encouraged to adopt policies and inform their staff on risks? I mean, even though, as far as I know, policies exist, but it's merely how
Mhm.
we can inform and act. Over to you.
Yeah, I think this comes back to what I said earlier, that, you know, when we are dealing with national and local actors, it's not about transfer of risk, but also transfer of risk management capabilities. And I think this is where knowledge is important, but also tools and resources to be able to do that. You know, at the end of the day, every staff member needs to understand her or his rights. I think this is the principal fact, that, you know, if people don't understand that it's their right to have their organization taking care of them, then of course it's very hard for them to even know or demand. And in many instances that we know that many local actors, you know, we can talk about the Red Cross and Red Crescent, they are quite established local actors. But there are also other civil society organizations that are used that probably don't have that knowledge or that access to knowledge, so they don't know their right. So I completely agree that, you know, duty of care also should happen before, you know, a partner is being utilized. I think that I think one of the models, UNHCR, for example, does very well with their partners. They do a lot of capacity development. They do a lot of engagement. And I would love to hear, you know, how large organizations like UNHCR, in dealing with their multitude of local and national actors, you know, invest time to actually talk to their local and national partners about duty of care, their obligations, and therefore what, you know, measures can be put in place to mitigate and reduce risk for those actors themselves.
Well, actually, this is really along the lines of a question we just got, which is about not only insurance, because insurance happens only when something happens, but how can we do better in terms of prevention, where duty of care is not cannot just mean making sure families get a pay out after the staff member has died or has been injured in service, but rather how actually we can prevent that and provide and create a safer operating space for all staff, whether they are national or international. And this is also about what you were talking about just a minute ago regarding mitigation measures. The other question is really, you know, I think all humanitarian at all levels are very much adhering and committed to duty of care. But when it comes to donors, the question is underlining the fact that in theory they support the idea of internal funding mechanism, but the bureaucracy linked to that and the monitoring and all the requirements sometimes and most of the time makes it almost impossible option. So how would you advise to move from words and empty commitments to actual practice? Over to you, Dr.
Well,
Mahmoud.
yeah, I think what we need to do is find some really good champions. I want to really highlight Netherlands as one good example. We know that the minister is a real champion for mental health, in making it something that is important in the aid sector, putting money behind that commitment, ensuring that mental health is one of the important areas of our work, not just in terms of looking after, the people who are affected by crisis and their mental health needs, but also the mental health needs of our staff, right? So I think that, just as that happened, similarly with sexual violence and other issues, you've had champions to stand up to say, okay, we need to do this. For example, UK had this big meeting and a lot of governments came. So mental health, Netherlands led that. I think we now need to find another champion. We need to find a champion on duty of care. We need to, advocate, each and every one of us, to the donors that we meet, to say, look, this is going to be critical. If aid workers can't do their jobs in a safe environment, feeling that they're protected, that they're cared for, then, sooner or later, we're going to have a time where people do not want to get into the humanitarian sector because of the amount of stress that they have to go through. Because if I ask, my younger children, would you do the things that, I've done? And they say, well, I need to make sure that mentally I'm prepared for this, because younger people are very sensitive to this. They're seeing their peers already, succumbing to a lot of mental health issues. So I think that if I look to the future, that future workforce that we're going to look for, they're going to want this from us. And I think we have to begin this dialogue very strongly now. And each and every one of us who are dealing with donors need to have that conversation.
Yeah, well, this is very helpful. We have some participants who are also sharing some good resources. OCHA Turkey is informing us that they have developed a risk management toolkit to help partners understand and manage their risks, and they will be happy to share it. And please, yes, share it so we can share it with all the participants. And we had CHS Alliance, who has a newish major effort initiative for organizational culture and compassion and care, staff related. So please, I encourage all the participants actually to share all the materials they have so we can really share it with everybody. And learning from each other is also one of the objective of this webinar. And this brings me to another question. Of course, when you have signed a contract, that should cover from the day you start to the day you retire, obviously, including when it comes to duty of care. But we know also that as humanitarian, we are not only working with people under contract with our own organizations, but we are working also with other volunteers, community volunteers, and others. What do we do for those to make sure that we are still up to our commitment and our duty of care? Over to you, Dr. Mahmoud.
Yeah, I can speak from the perspective of my previous experience working in the Federation. The Federation is the network of national societies, and the DNA of how the Red Cross and Red Crescent works is through its volunteers. So, and if you have 14 million volunteers around the world, your duty of care is also to those 14 million volunteers. And I think that, we just, we talk about, insurance, we talk about putting money aside, we talk about, engaging with donors about funding. But I think most importantly is that how do we, and I think this is the most wonderful thing about the Red Cross Red Crescent movement, how do you actually start learning from each other, how you engage with those volunteers, how you actually build, those relationships of trust, and also ensuring they understand their rights as well, and they understand, that they need to have access to duty of care. So I think it's not easy. I will tell you now that it's not easy, especially when there are millions of volunteers. But it's also about, most of the time, listening well. Most of the time, local actors, our volunteers, want to be heard, and we need to provide that space for them to be heard. We need to be humble enough to acknowledge that we may not be able to give the best that we want to give because of lack of limited resources and so forth. But finding that solution within those communities as well. What might apply in Malaysia may not apply in Europe. So what are the social structures within those communities as well that we can lean on, right? And within the social safety nets and so on and so forth. So how do we look at our humanitarian sector as part and parcel of a broader network out there within countries or within communities?
Yes, indeed. And I think we should also remember that duty of care starts also by just providing a safe space to the people we are working with, as a manager, and to listen to them to start with. And sometimes that can also be very helpful. The next question is about how can you balance the collective responsibility in a way that does not take on a responsibility that actually lies with the organization's management. And I am sure, Jamila, you have been through that many times.
Yeah. Yeah, I think if you're in management, then how do you find that balance between running your organization and ensuring that the people who are the bread and butter foundation of the organization are taken care of, and this is where it's also about making the right choices, right? And prioritizing what the organization should be putting their resources to. So I don't think I have a silver bullet to answer this question, but I think that at the end of the day, how do we collectively as humanitarians help each other better understand, learn, and actually test out? And I think testing is very important because this is an area that is we talk about as important, but we haven't really found many new ideas on how we tackle duty of care. So I think a lot more new thinking has to go into this. And I keep saying that it's very cultural, it's very nuanced. There's no one size fits all, but the fundamentals need to be there, but how do we now learn from each other? And how do we learn from industry? I'll be curious to see how does the business industry, for example, extend duty of care to its staff? Are there things that we can learn and models that we can take that we can apply to our sector? So I think we've got to be a bit more, think a little bit more outside our sector and trying to find some solutions outside as well.
Yes, indeed. I mean, I'm not sure, though, that all the private sector and industry are providing duty of care to all their staff, but it will be interesting to find out. And I think we all have in mind many examples where actually this is not happening. As expected, I mean, of course, there is a lot of skepticism about actually how we are effectively delivering in terms of duty of care, whether as a UN agency or also as an INGO. And the question is, what would be your advice in convincing UN agencies working in humanitarian aid to implement minimum duty of care standards for all of their partners, even though we don't want to look for minimum, but actually the highest standard of duty of care for all of the partners, and also for the implementing partners of UN, namely international and national NGOs. Over to you.
I think that this is something many of us have been working on for the longest time, right from the time of the summit where, there was a lot of discussion about the importance of local actors. We have been pushing for that, certainly in the grand bargain. People may think about, the whole localization agenda as one that is about funding. Actually, it's not. It's also about increasing support and capacity to local actors. Local actors have been standing up, and I think that we have to acknowledge that some of them have been quite successful and vocal about what they want, as the whole shifting the power dialogue, right? but it hasn't really happened because unless donors themselves understand that it is crucial for national and local actors to be supported, the international organizations, including the UN, will have their hands tied on how they spend their funds. I cited UNHCR, and I will cite it again, that it's been really, the commitment from UNHCR to actually look at supporting their local partners is actually quite commendable. But when you think about it, right, when I was working in the Federation, millions and millions and millions of dollars were channeled through local Red Cross and Red Crescent societies, yet not a significant, in fact, hardly any was spent on really supporting their capacities, now beyond their capacity to deliver the project. So really a commitment to look at organizational capacity strengthening, about really investing in their ability to be able to do good risk management. I can speak from my own personal perspective. When I started my organization, Mercy Malaysia, many years ago, I realized that, there was no one to help me, no one from the UN, no one from the international donor, because our funding was basically from national funding, from public funding. But I actually turned around to the private sector, and I know people are very skeptical about private sector, but they were responsible for ensuring that I had a good risk management framework, we had accountability standards, we built in systems so that no matter whether I'm there or I'm not, the organization will thrive. And I think it's thriving, well now, even in my absence for more than 1 decade. So, who do you look for to build that, to build that capacity and to build the systems in local and national actors? And I think this is where I'm appealing to, whoever's listening out here, whether you're a donor or the UN or an international organization. This is not about, losing power or anything like that. This is a smart investment. If you actually develop systems and capabilities of your local and national actors, you get better performance, you get better delivery of assistance, you get more accountability, and that's what you want. And eventually, I think that, you can then transition as international organizations to a different form, one that is a mentoring organization, one that is looking at, success as the ability to be able to entrust your local and national actors to do the work in a way that is, accountable, that is high quality, and so on and so forth. But that will not fall from the sky. It must come with investment. And to any local organizations who are listening, I will tell you now from my own experience, if you can't get it from your international partners, look elsewhere within your own communities, within local businesses to find people, but you must be equally committed to wanting to have those systems so that you can then have enough resources to build your risk management frameworks, to build your own staff safety and, and security.
Yeah, I hear Dr. Mahmoud. I mean, it's a collective responsibility, but also a collective action, and not only expecting that coming from others. But just before getting additional questions, I really will be very interested to hear from you, about your new role as a senior member of the government, and in the midst of this global COVID-19 pandemic, what have you observed which is related to duty of care? Over.
So it's been really incredible. I've not worked in government since I was a young doctor, so it's been very interesting to now step into, the Prime Minister's office now, working to look at, strategies in dealing with not just COVID, but also broader health issues. One thing that we've realized, and Malaysia is one of those countries that is very fortunate. It doesn't have earthquakes and many major crises, but we did have the experience of SARS and other sort of health crises, and therefore we are very fortunate to have a very good health system that is capable of dealing with many of these issues. But what we did realize is that, this is classically, you can talk about the grand bargain and localization, and then what you need is a pandemic to wake everyone up to realize, hang on a minute, we can't get in, right? We can't have international actors running around, and we have to depend on local actors. Now, of course, in a country like Malaysia, there are strong institutions. So you have, government entities that are going out to deliver assistance and so on and so forth. But it's not enough because, it is local civil society, it is the Red Crescent, it is the Mercy Malaysians, it is all these local and national organizations as well as private sector that are actually putting a lot of effort into trying to meet the needs and really ensuring that no one is left behind. So the government has now realized, and this is a good thing, is woken up to the fact that they can't do it alone. And it's been, I've just been back now 3 weeks, and I'm very happy. Actually, 2 weeks and a half. I'm very happy to say that we will be establishing our first ever NGO coordination platform, and we're calling it Match. We're going to get Malaysian civil society organizations to help each other, number one. For example, Malaysian Crescent as a strong organization with Mercy Malaysia to be able to then mentor smaller civil society organizations. We'll be able to look at what the needs are and then bring that needs to government agencies as well as private sector, so that hopefully, together we can collectively look at how we can ensure that people get their needs met. One of the things, of course, is that how do we look at their safety and well-being? How do we look at their mental well-being? How do we look at the issue around stigmatization? And this is another problem that we are facing with COVID, right? If you are out there, attending to the needs of people who may be at risk of having a disease, or if you're a health worker dealing with patients with COVID disease, then how do we ensure there's no stigmatization, there are no particular groups that are targeted? And I think this is where civil society plays a very important role. So I'm very pleased to say that the government has really embraced the idea of an NGO coordination platform that will be able to work, in synergy and complementarity, to be able to, see how we can do things better. We also have refugees in this country. We have the UN country team, but also again working through local and national organizations to meet the needs of these refugees.
Thank you very much, Dr. Mahmood. I mean, it's talking about your new career, and I am sure you will bring to it as much as you did in the past. It is actually very much reassuring that there is a life after an international organization. So it's really a great news and very promising news for many of us, working in international organization. I like very much the parallel between duty of care and no one is left behind, because it's really about that. It's really about not transferring only the risk, but really making sure that we build the capacity, we train on risk management. And Turkey actually has just shared with us what they have, the risk management package they have developed, and we will share that with everybody. But one of the participants actually also pointed out to the fact that duty of care is not only about the staff who are working in an organization, whether national or international, but it's also for managers. Can you tell us a bit about that, Jamila?
Of course, I think duty of care applies to every member of staff, and that includes the top person to, whoever's out there. Everyone has a right to duty of care. So, it is beyond just, thinking about people who are in the field. So, having been in leadership positions before, I can tell you it's a very lonely place, because there's a lot of expectation on the leaders to be able to take care of everyone, and then who takes care of the leader, right? So I think that having I want to give a real shout out to my colleagues, my former colleagues at IFRC. We have the chief of staff every day sending out a message on duty of care, and it's simple messages about, how are you sleeping, what are you doing for exercise, it's normal to feel frustrated. Here are some tips, here are some links. Yeah, it's so reassuring that, you have, from the Office of the Secretary General, sending out to all staff. And similarly, each and every one of us who has a boss, should be also, reassuring our bosses that we care for them too. So I think it's a two-way street, right? But we often forget the leaders at the top who also are human and need to feel that they are also working in an environment that is good for their own mental health and their well-being as well. So duty of care cuts across all sections of an organization. It is also duty of care as an organization and duty of care to the people we serve.
Yeah, and duty of care not only about insurance and training, but also about compassion and empathy. We don't say that enough, and often enough. That I have a last question before giving you the floor to conclude. It's still too often international partners consider the risks of working with local partners, and there are many tools that are developed for that, and not the risks on their local partners. How do you think we can move away from this? I think you addressed that several times today, but maybe you can use that for your concluding remarks, Dr. Mahmoud.
I think that it's an obligation, it's a duty, as whether we're an international organization or a donor, to think about who is actually delivering assistance on our behalf. And, duty of care is critical for that. Sometimes in humanitarian action, we talk about professionalism, but professionalism is not about, corporatization or bureaucratization or risk aversion. It's about really mastering our skills, accumulating our knowledge, improving ourselves continuously, really being able to have that empathy, the ability to listen, and the ability to act. There's no point listening without acting as well. And I think that if we can agree to a common ethical framework and we decouple that, from interest of the organization or personal altruism, really focusing on the job, as well as possible, and ensuring that those, as I mentioned right from the start, you have to stand up for those who protect those who save lives, right? We have to protect those who save lives, and I think, each and every one of us has to stand up for the safety, the well-being of local humanitarian staff and volunteers. Najat?
Yeah, hello?
Yes, I'm here.
Yeah, well, thank you very much. I mean, we will remember it's about listening, compassion, empathy, caring about our staff, caring about our managers, an ethical framework, a moral duty, and above all, a duty for all of us actually to better deliver and to better support the most vulnerable people. Thank you so much for your answers, for your time, for your participation, and for sharing your wonderful experience, understanding, and sensitive, messages with all the participants. I wish you all the best in your new duty. And it's a great gain for your own country. And we are as proud as your people in Malaysia to count you among humanitarian in our community. Thank you so much, Jamila. Thank you.
Thank you, Najat. Thank you, everyone.